Our next speaker is John Brownstein. John is at Harvard, where he studies methods for real-time mapping of COVID-19 cases worldwide. Thanks, John. I see that you're already sharing, so take it away.
All right, great. Thanks, Russ, and good to be here. I'm going to be telling you a little bit about a variety of our activities that we're engaged in right now as far as COVID surveillance. Obviously, it's all work in progress. So the idea here is just to give you a sense of the kinds of things we're actively doing and some preliminary results. We've been tracking coronavirus since the emergence event in late December. And this is just a graphic showing the data that we're collecting over time as it spread globally. And the reality is being able to create a visual and sort of a situational awareness of this kind of data is really challenging given the lack of sort of official sources. The earliest signs of what took place in China were actually through our data mining tool called Health Map, where we identified the earliest signs of the outbreak through mining in Chinese language and local news media, WeChat, Weibo, and highlighted the fact that you could use these tools to basically uncover what's happening in population. It's something that we've been doing for many years through many disease outbreaks. The reality is that the only way to create sort of a situational awareness view of what's taking place is through mining of all this information and collating it. What we quickly realized is that as much as it's easy to sort of scrape the web to create a real detailed line list of cases around the world, you need sort of an army of people. It can't just be done through machine learning and web scraping. And so we created a network of organizations from Oxford, University of Washington, Northeastern University, many others, that essentially created a global line list of cases. So combing the web through official and unofficial reports, creating a detailed line list of every single case around the globe. And that becomes more and more challenging over time, clearly. But that ultimately now resides in a public site on Health Map. And that data is made freely available. And because that data was heavily curated and made available, it's generated a whole set of publications all aimed at forecasting and understanding sort of the risk in different populations, and especially understanding the efficacy of various interventions. This is a paper we just published in Science last week, which essentially utilized our line list data along with mobility data from Baidu. And because Baidu has highly granular data on population movements, we could connect movements to sort of case information. And as soon as interventions started coming into place, we saw the massive drop in cases that were taking place in China. So that's just one example of a way that once you built a really detailed case count, you can actually start to fuel a lot of both the science as well as policies related to interventions. We're doing this in a whole variety of ways, not just through data scraping, but through collecting data from the general public. This is our tool called Thermia, which is actually identifying fevers in populations through sort of a decision tree. This is something that we launched years ago and connected that to smart thermometers like the Withings Thermo device. But the reality is we actually already had in play a fever calculator in China at the time. And so what we were doing was actually collecting data, not just from official sources, but through people that were disclosing symptoms as well as temperature. And of course, we saw the bubbling up of case or symptomatic cases, which, not necessarily confirmed across China at the time of the emergence of COVID. So again, another good example of how the sort of collected data across the population can be incredibly valuable. We've extended that work with a number of different symptom checkers. This is a company called Buoy that we're working with. It's an AI-driven conversational chatbot that we have helped sort of customize for the purposes of COVID. And already this tool has been widely deployed and shows incredible diagnostic and triage accuracy. And so right now, this tool now has been made available for the state of Massachusetts and more broadly, where essentially the case definition for COVID has been entered. And so now anybody who has sort of, potential symptoms around COVID can go through this sort of conversational interface. On the other end, we're going to be collecting data from this tool to basically improve our surveillance efforts at the local level. A lot of our work is not just about sort of getting sort of the digital exhaust from patients, but it's also crowdsourcing. This is a project we launched actually 9 years ago off the movie Contagion called Flu Near You, where we engage people to answer a few questions and then essentially get a national army of people responding about symptoms across the country. And what's phenomenal about that is you can, for instance, look at the emergence of flu in a population very easily. We've now adapted this for COVID, so COVID Near You, which is now launched about a week ago. And this has, been crafted to have specific symptoms that relate to COVID, as well as collecting testing data. Of course, clearly we have a lack of testing across the country. So being able to have insights into patterns, emerging hotspots, can be driven heavily by individuals just contributing information. And so right now in the system, we have over 260,000 people now reporting symptoms, and doing that at a fairly frequent clip. And so from that, we're now, of course, in the process of analyzing all this information, looking at demographic patterns, symptom patterns, connecting that to testing data, looking at contact tracing, and of course, lots of other opportunities as this emerges. We're actually expanding this to other countries at the moment. The last thing I'll just mention is it's not just about mining for case information and events and symptoms. We're working closely with the CDC to build tools to actually have understanding of social distancing impacts. So what are communities doing to prepare for coronavirus? There is no sort of unified data set to look at school closures or closures of various community events. And so we're pulling together all that policy information and events at the community level to then provide sort of a common operating picture for the CDC as they're trying to understand sort of the variation in sort of interventions that are happening across the country. And clearly being able to have that kind of data and matching that to epidemiological information will be super important to understand the efficacy of the various interventions. And we know that there's major variation across the country. Obviously, many places not had stay-at-home orders. Many places we're not seeing as much sort of adherence to sort of the general policies that have been put out. So being able to connect this kind of data with epi data, then we'll be able to do some of the same studies that we did for China. So I'll leave it there. Look forward to discussion. And sorry again about the technical difficulties there.
Thank you very much, John. Really exciting stuff.